This is an example of low physiologic IOP in standard cataract surgery. The IOP is set at 30, with a vacuum of 450 and aspiration of 24. The IOP ramp is set to fast, and the irrigation factor is at 1.6. Active Sentry is enabled. After precortical aspiration, an initial horizontal chop is performed to divide the nucleus into two halves. A dry chop technique is used to divide the halves further and create a total of 6 pies. It is important to create a complete chop to produce individual loose pie segments. The initial pie is introduced into the phaco tip and emulsification commences. The aspiration flow rate may be increased to 27 or 28 to improve followability without compromising chamber stability. At no point during the surgery does the patient experience discomfort. There are no post-occlusion surge episodes. Active Sentry actuations are minimal with these settings.